Health systems and organizations get paid in different ways. Understanding this can help us be better partners. There are two types of payers, public and commercial. You will also hear commercial insurance called private insurance. Public payers are Medicare and Medicaid. They are called public because the federal and state government provides funding for these payers from our tax dollars. Commercial payers are health insurance companies. These companies are privately owned, not publicly funded. Commercial insurance could be provided by an employer or purchased through a state marketplace. The payers all operate under different rules. The rules are set by the government in the case of public payers, or by the company in the case of commercial payers. So how does payment actually work? It starts with medical coding, which is the way clinical work gets documented, communicated to payers, and reimbursed. There are 3 coding systems worth knowing. ICD-10 codes capture diagnoses. CPT and HCPCS codes describe the type of care provided, the evaluative and intervention activities delivered by healthcare providers. For billing to go through, the diagnosis codes and the service codes have to logically align. ICD-10 codes are also valuable beyond billing. Because they capture diagnoses at scale, they can give public health practitioners insight into the prevalence and incidence of conditions across populations, useful for identifying partnership opportunities. It's also worth knowing who tends to use which type of payer. Public payers, Medicare and Medicaid, are most commonly used by people 65 and older, people with low incomes, and people with disabilities. Commercial payers are typically used by working-age people with employer-sponsored or marketplace coverage. This matters for partnership. Health systems serving a high proportion of public payer patients face different reimbursement pressures and incentive structures than those with a predominantly commercial payer mix. Understanding the payer dynamics that health systems face can help us select partners who are ready to engage with public health.